We need to take mental health very seriously because it's as important as physical health. We need to take it seriously because up to 20 to 25% of the population have mental illnesses at one point or the other. That's translating to the fact that 1 in every 4 individuals will have mental health challenge at any time. So it's a very serious thing.
We need to break that stigma so that people can access care as at when they need it without fear of being labeled. I think that is one of the factors that are keeping people. Break that now. And like the theme of this year, access mental health services. Okay? Because they are there for us. No matter how limited the services are for now, but we still have a starting point. We can expand.
World Mental Health Day. Who is it for? What is the purpose? And why do we celebrate it? Welcome to the LUTH Podcast, a platform for real conversations with seasoned professionals. For today's episode, in commemoration of the World Mental Health Day, we'll be discussing with a mental health professional, Professor Francis Olatunji Aina. He is a professor and consultant psychiatrist at the Lagos University Teaching Hospital. Thank you for joining us today, sir.
Thank you very much. So let me say good day to our listeners. And the World Mental Health Day is so designated by the World Health Organization as a way to lay emphasis on our mental well-being, and is usually celebrated on the 10th of October every year. That's to show the importance of our mental health. And the reason is not far-fetched because virtually everyone can have mental health issues. It cuts across race, it cuts across gender, it cuts across socioeconomic status, and so on and so forth. So as we pay attention to our physical well-being, we must also pay necessary attention to mental well-being, because the definition of health encompasses the fact that it's a total well-being, both physical, mental, as well as social.
Thank you very much, sir. You're already answering some of our interview questions already.
Okay.
So before we dive into the interview, can you introduce yourself to us? Tell us a bit about your journey so far.
Well, as you rightly introduced earlier on, I'm Professor Olatunji Francis Aina, Professor of Psychiatry in the College of Medicine, University of Lagos, and consultant psychiatrist with LUTH. I'm also the head of the Department of Psychiatry in the College of Medicine, University of Lagos, and LUTH. So my journey into psychiatry is a tortuous one, because when I finished my MBBS program and made my intention known to specialize in psychiatry, it was really a tug of war because of the stigma associated with psychiatry. Both for my teachers in the medical school then, my classmates, my relatives, they frowned at the fact that I wanted to specialize in psychiatry. As a matter of fact, one of my very renowned relatives said, of all specializations in medicine, so you want to go into psychiatry, why? Are we not losing this young boy? It was so bad. But nowadays, I thank God that many people are coming into psychiatry because of the mental health challenges and the fact that there is increasing awareness and people see mental illnesses as just like other physical illnesses. But in those days, the stigma was really, really terrible. There's still stigma against psychiatry nowadays, but with enlightenment and education and information available, more people now realize the need for mental health and well-being.
Okay. Thank you very much, sir. A lot of people tend to overlook mental health, as you rightly said, and it's seen as less important than physical health. In fact, if people go to work and say, "Oh, I'm not feeling fine physically," they can get a sick leave. But if you go to work and say, "I have a mental health issue," they, especially in our context, it's like you're not serious and you don't know what's going on. And so we want to ask that, can you tell us some of the most common mental health issues you have seen or you have encountered in your clinic, and why should we take these issues as seriously as we take physical health?
We need to take mental health very seriously because uh, it's as important as physical health. Because I could remember one year, the World Mental Health Day that was celebrated some few years ago. The theme then was that no health without mental health. That was to show the emphasis the WHO laid on mental health that particular year, and they still lay on it. Now, we need to take it seriously because up to 20 to 25% of the population have mental illnesses at one point or the other. That's translating to the fact that 1 in every 4 individuals will have mental health challenge at any time. So it's a very serious thing. The only thing is, when you say common mental health problems, we have to dichotomize it here. The ones that are commonly seen in the general population and the ones that are commonly presented in psychiatric facilities. They are two different things. In the general population, for instance, the commonest psychiatric disorders that one is likely to encounter include anxiety disorders, depression, and what we call somatoform disorders, and so on and so forth. But in psychiatric facilities, we see quite a number of major psychiatric disorders that are being brought for the attention of mental health professionals. Things like depression also, as well as psychotic disorders, which are major mental health disorders. So you see that in the public, in the general population, compared to the psychiatric facilities, the common psychiatric disorders are a bit different. You may ask the reason why. Many people with anxiety disorders, quite a number of them can still manage their mental health challenges on their own. For some, particularly in this part of the world, they do self-medication. They're able to overcome that. And again, we have alternative mental health practitioners. For instance, in this part of the world, people are very religious. So they may go to religious centers to seek for solutions. But some of them may patronize traditional healers that are able to take care of these cadre of mental illnesses at their own level. Then again, quite a number of them even can present to the GPs, the general practitioners, because we know that compared with the developed countries of the world, a number of our patients in this part of the world, they somatize. What we mean by somatization is the fact that they give a lot of physical complaints as overlay over their psychiatric disorders. So such can now patronize general practitioners presenting as if they have physical illnesses. Okay? Those are categories of patients you see presenting with recurrent malaria. Some of them will be diagnosed to have typhoid. Then some of them will be diagnosed to present with things like they say they have fever. Whereas when you scrutinize very well, it's not really fever, it's internal heat. Then some of them will complain of chronic sensation. So the general practitioners see quite a number of them. It's only very few of these categories of patients with anxiety disorders or minor psychiatric disorders that present to psychiatric facilities when they are not able to get appropriate treatment in this lower cadre of health services. So those are the things about the common mental health disorders.
Okay, thank you very much, sir. So, you've mentioned the stigma, and so I'm guessing that stigma is a common barrier to seeking mental health care. So, what can be done in both in the hospital and even on an individual level, organizational level, to help stop this delayed treatment or delayed seeking of help? How can we, contribute to better mental health seeking behavior?
Well, it's a good question. Stigma against psychiatry or mental health issues is all over the world. It's all over the world. But we know that stigma is much more pronounced in developing parts of the world, like Nigeria or Africa in general. But stigma against psychiatry is all over the world. Now, apart from stigma, there are many other things that constitute hindrance to access to mental health care services. For instance, things like available mental health professionals. In Nigeria, for instance, we have a very inadequate number of mental health professionals, psychiatrists, clinical psychologists, psychiatric nurses, social workers, occupational therapists. They are in short supply in this part of the world. And over time, in the past few years, it's even worsened by emigration of these mental health professionals to greener pastures, the so-called Japa syndrome. So that's an hindrance on its own to access to mental health care services. Then again, available mental health services facilities. Despite the fact that we have, as of today, for instance, we have uh, standalone psychiatric hospitals owned by the federal government. I think about it used to be 9 in number, but in the last few years, 10 were also established. I mean, 2 were also established to make them 11. Then some states, they also have their mental health care services, especially Lagos State and some few other states. Then all the teaching hospitals, compulsorily, they must have Department of Psychiatry for training of medical students and for services to patients, as well as to meet up with the accreditation of medical schools for training. Then the general hospitals, some general hospitals run by the state governments, they also have psychiatric departments or units. Then federal medical centers, quite a number of federal medical centers also have Department of Psychiatry or Psychiatry. So in the past few decades, there have been multiplication of psychiatric facilities that individuals can access. Then the stigma you mentioned is a major hindrance. It's a major hindrance because many people, when they are mentally ill, they do not want to visit the mental health professionals so as not to be stigmatized by people. Okay, and this is especially so for standalone psychiatric facilities. And that is why the establishment of psychiatric departments or units in teaching hospitals, federal medical centers, and general hospitals, in a way, is also to overcome this stigma. Because by the time a patient comes to all these facilities to see a psychiatrist or mental health professionals, people may not know whether he has come to see other health professionals. So it's also a way to destigmatize. But in the recent time, or maybe I shouldn't go there for now, but in the recent time, these mental health professionals have been doing a lot of advocacy to destigmatize psychiatry. And there are so many NGOs that are even established by mental health professionals that are advocating for to scale up mental health care services and to destigmatize the mentally ill individuals.
Good day, everyone. Welcome once again to the LUTH Podcast. Today, we are going to be talking about mental health. So, in commemoration of the World Mental Health Day, we're going to be speaking to a seasoned mental health professional. And here with us, we have Dr. Charles Umeh. Please, could you introduce yourself, sir?
Oh, you have told them my name. My name is Dr. Charles Umeh.
Okay. That's fine, sir.
Yeah.
So, what do you do? Who are you? What is your line of work? What's your relationship with mental health, sir?
Okay. I'm a clinical psychologist.
Mm-hmm.
I'm also a teacher and an associate professor in the Department of Psychiatry, College of Medicine of University of Lagos.
Oh, thank you very much, sir, for having this session with us. We are really, really grateful that you came and made time for us. So, sir, I want to ask a couple of questions. So, what does mental health advocacy mean to you?
That's a big one. Okay, I won't talk about it without letting you understand what mental health is before we go to the advocacy.
Okay, I'll love that, sir.
Now, when we talk about mental health, people before now used to think it's about people who are mad and naked on the street, but that's not what mental health is. If you look at the WHO definition of mental health, it says it is a state of well-being in which people actualize their potentials. Now, this same well-being will enable them cope with their everyday life stresses. It will enable them work productively and contribute to the society. That is what mental health is. But the mental health disorders are things that can stop you from achieving these criteria required for mental well-being. And that is what has been in the forefront. So whenever anybody talks about mental health, the focus is usually on mental health disorders. Far from it.
Thank you.
Now, if you're talking about the advocacy, yes, the first advocacy there is this. Our slogan, there is no health without mental health. That is the focus. And that is exactly what has been lacking. And mental health education has been at the back door for a very long time. And so many reasons have been attributed for this. One of them could be stigma. Another one could be cultural biases towards people living with mental health disorders. Because in different cultures, they are interpreted differently. And that has been one of the major problems with advocacy. And good enough, COVID-19 was like a blessing in disguise. When a lot of people were restricted from moving, and restriction can incubate a lot of mental health issues. And that was when people started talking. And so many things started coming out. And ever since, that period has been the greatest advocacy we've had in mental health for a very long time. Before then, when people listen to people talk about mental health issues, they run away from you the next time because they think something must be wrong with you. And that's why they say, like, mental health facility like Yaba, they say, Yaba left. These are names that stigmatize the place. And if anybody sees you getting into that place, and this person is someone that's close to you, the next time you might not want to talk to you, thinking that you don't decolo. So these are some of the issues. But good enough, everybody is now gradually beginning to realize that mental health discussion is not about mental health disorders discussion. And these are things that will enable you actualize your potentials and maintain a state of emotional well-being to function in diverse way. That is where we are now.
Okay, thank you very much, sir. Because I was going to ask you about how the mental health conversations has evolved over time. Yeah. She mentioned earlier about the pandemic being a surge to mental health being talked about more among everyone. Yeah. And you also mentioned the stigma. So I want to ask, so recently, there's this issue of social media. Everyone is trying to advocate for mental health. Do you think personally, from seeing patients up close, do you think mental health conversations have evolved? Do you think there are more people coming in to see you than before?
I think, yes, there are more, but not enough yet. And that is where the advocacy is also very important. And I think it's high time we started discussing it in every space. In the workplace, we have things like employee assistance programs, which has never been implemented in most organizations, except for the multinationals that are trying to implement that. Because an employee that is emotionally stable could be more productive than the one that is not. And that is why it's important. Now, based on the way we believe certain things, a lot of Nigerians still patronize churches, traditional homes, and other settings. And they have a lot of followers. So I think we should channel mental health advocacy to religious institutions and those homes that we have a lot of patronages from our people. Because if the imam is telling his followers about the essence of maintaining a good mental health state, they will listen more. If a pastor from his pulpit is letting his congregation know that the need to maintain a balanced mental health, then they could listen. And also communities. Yes, because, and if I want to talk about that, it becomes a bit of a problem because most of the mental health advocacies end within the urban area. Nobody is going down to the rural areas where some of these problems are bound, okay, to educate them. And that is where I think that a strategic approach to this advocacy, taking it down to the poorest of the poor, okay, could go a long way in helping this campaign. And we've not had any straightforward approach to that yet. What we have is inspired intellectual discussions in the urban areas, okay? And these things are not taken down to the rural areas where people will benefit from it. So I think that could be a good strategy for us to go. Okay? Probably in the primary healthcare, integrating mental health education and services down to the primary healthcare. Even if it means retraining other health professionals to know the basics. Okay? So that this thing could get to the people that need it. And I think that is the way to go.
Thank you very much, sir.
Yeah.
So all we've learned so far is that all hands needs to be on deck in the aspect of guarding mental health, from the pastors to the imams to the entire community, and even taking not only mental health advocacy from urban areas, also taking it to rural areas that will help us in the long run.
Yes.
So I have another question. When people are faced with mental health issues, there's this confusion between who to see, the psychiatrist or the psychologist. So what are the different roles that both have to play in dealing with mental health issues for certain individuals?
Oh, that is a very smart question. I'm going to answer that question this way. Now, when you talk about mental health, you could see that you're not talking about a morbid condition yet. It is something that can affect somebody's general well-being. Okay? Now, when it becomes a severe problem, then we are talking about impairment, dysfunction. Okay? And that is the beginning of the difference between psychiatry and clinical psychology practice. A clinical psychologist is trained to detect differences in behavior that can affect individual general well-being and functioning up to the level that they can become what? Severe. Most of the severe cases start from what? Little impairment. So, and that is where prevention is. So let's say the clinical psychologist in the mental health ward is like a gatekeeper. If you go through the clinical psychologist, it can nip the major symptoms in the bud with his intervention, assessment, and other treatment protocols. So that some of these minor issues could not degenerate to severe conditions. However, there are already severe conditions on their own that can come from genetic predispositions and other biological factors. For instance, a condition like schizophrenia is a major condition that, even though it could be triggered by environmental trauma or stressors, but it is inherently genetic. Okay, so when it comes out with severe symptoms that require psychiatric evaluation and intervention. So invariably, psychiatrist is a medical doctor who is trained in the art of treating mental health disorders, especially using the biological approach. But the clinical psychologist does not use the biological approach because he believes there are so many other factors that are involved in mental health conditions that might not emanate from only biological conditions. So the focus of intervention is psychotherapy, looking at the social psychological factors that can impact negatively to somebody's mental health and then nipping it in the bud. The other way around, there is a meeting point between both because those severe conditions can also require some psychological intervention and vice versa. So that's why you cannot actually separate clinical psychology practice and psychiatric practice. So, but the major differentiating factor is the technique for intervention.
So, from all you've said so far, I'm gathering that when a person actually has mental illnesses or they have mental health issues, the psychologist and psychiatrist have to work together to help out. So, thank you very much, sir.
Thank you very
So, I
much.
want to ask a question. In Nigeria, we see that there are not a lot of clinical psychologists. So, what do you think is the cause of that? Because you are one of top-notch psychologists we have in the country. So, why are there not as much psychologists in the country presently?
It might not surprise you to know that in Nigeria, where clinical psychologists are not properly recognized, it was until wasn't a few years ago that they were captured in the establishment. So even the government does not reckon with clinical psychologists up until recently. So, and then when people train as clinical psychologists, you find it difficult employing them because they are not captured in the civil service cadre. Despite all the years and therefore they put in, despite all that they can do, the nation never deemed it fit to recognize these people until recently. Even currently, with the civil service cadre for psychologists, they never paid attention to entry point for clinical psychologists. You cannot become a clinical psychologist until you have a master's in clinical psychology. And that takes a long time. Now, but what we have now is a level 8 point of entry for everybody. You can see. So with that, our people have a lot of prospects abroad. Most of them, Japa. So except the ones that are staying behind are the ones that have other things they are doing. Yeah, that is keeping them. I've trained over how many interns, but none of them is in Nigeria anymore. Because the condition of service, the remuneration, the recognition is not there yet. So, but consider the importance of the clinical psychologist in the health sector and even in the well-being of the society. You could see they should have a right of place in the scheme of things, but they don't. So our advocacy there is let government recognize, sign our council bill, and give them right of place to function. Then we can see whether we can retain the younger ones who we are training now to fill the gap. You can see, if you check the WHO patient clinical psychology or psychiatrist quota, you can see that you might be having one in over 100,000 or 50,000, which is far, far below the WHO standard.
Hopefully, with this episode, our viewers will be able to
see more that psychologists also have an important role to play, and even the government to see that they need to be recognized as well. So you've been in this field for a long period of time. So what is one of the memorable things for you that you've experienced that keeps you going or keeps the passion alive for what you do for other people in this issue of mental health?
That's a beautiful word too. Now, for people like us, we believe that what we do is acknowledged by people we work with. For instance, one of our sustaining factors, especially me, is the fact that knowing that people come back to testify that what I did with them worked so much. Coming from the background that people never, even in healthcare facilities, people don't even know what we do. They still don't know that clinical psychology can see a patient and the patient gets well. So when you encounter such a case, you diagnose a patient, manage a patient, and the patient recovers and comes back to what? Thank you for that job. Can you see? It motivates you to do more. That means you need to create more awareness by the work you do. That is what has been keeping people like us going, not the remuneration.
Hopefully things change in due time.
Yeah, we pray so.
We pray so. So there's this link between mental illness and substance abuse, and you have a number of work on the use of psychoactive substance. So I want you to please explain to viewers what are the psychoactive substance and the relationship that mental health has with substance abuse.
Okay. When we talk about psychoactive substances, we are talking about substances when ingested could affect the way we think, the way we feel, and the way we behave. So invariably, these substances have the ability to control your general function. Apart from that, they contain some active ingredients that are addictive. So anybody that makes use of those substances could eventually get addicted or get dependent on such substances. And when you are dependent on such substances, it means that they are controlling what you do now, not the other way around. And that means a lot of them, based on the category and the dosage the person is using, and also the frequency of usage, could lead to a lot of mental health issues. We have various categories like the depressant, which alcohol is part of it, but people don't even know that. Then we have the stimulants like the cocaine, amphetamines, and co. We have the hallucinogens. These are what we call the mind benders, where cannabis belongs. And we have also the inhalants, like this wax, all these thinners that ladies use in their thing. Yeah, they have such effects. Okay? And so many other categories of these psychoactive substances. So, based on the category they belong, they produce that effect. But there's something they all have in common that people tend to abuse them. And that is, they have the tendency of creating euphoria in the mind of people who make use of them. Okay? And if that happens, it can lead to the craving for it more and more. And it's a very big issue currently among youth. And anybody that is addicted can never actualize his or her own potential again, because the drug will kind of destroy the person's mental well-being, one way or the other, except the person begins to seek for intervention. But the funny thing is, like, a lot of them don't. A lot of them don't. So it behoves on people around such persons to kind of convince them into going for intervention. You could see it's very rampant among youth these days. So everybody should be his or her brother's what? Keep an eye. Because most of them, for which psychiatric substance is a problem, don't have insight into what they're doing. and they don't think they need treatment. The people around them will notice that their behavior or behaviors are becoming impaired, and such a person will need intervention.
Yeah, thank you very much, sir. So, looking at substance abuse and mental illnesses, which one do you think precedes the other? Is it substance abuse before mental illness or mental illness before substance abuse?
Okay, that question is a technical one, and I'm going to explain because it has been ongoing it's an ongoing discussion in the mental health space. I'll take it this way. The use of psychiatric substance can predispose some people to mental health disorders. Okay? Invariably, presence of mental health disorders can predispose people to psychiatric substance use. I'll give instances now. If someone is depressed, he wants to get the mood kicking, right? If someone is traumatized, he wants to live in his mood. The tendency is that they go the psychiatric substance way to improve their mood. And, you cannot get hooked if you don't use for whatever reason. So because they are trying to improve their mood due to their state, they get hooked. Can I say?
Yes, sir.
Good. So that way, the mental health condition has predisposed them to psychiatric substance use. Invariably, young people that want to experiment with psychiatric substances without knowing that they have the predisposition to coming down with such mental health condition, immediately they take cannabis or other psychiatric substances. They become psychotic. Can I say?
Yes, sir.
So, invariably,
It's a vicious cycle.
it's a vicious cycle. So you never can say, it's when you clock the patient that you'll be able to know which comes first and what the predisposing factors are. So they can affect each other both ways.
Thank you very much for sticking around to the end. We hope it was as delightful and enlightening as we promised.
Please, if you enjoyed the video, don't forget to like, share, comment, and subscribe. And let's together stop the stigma.